Happy New Year, and welcome to the 9th edition of Legal Affairs. I am Lawrence Ma. Today, we will talk about Hong Kong's ongoing battle with the COVID-19 pandemic. President Xi Jinping recently issued a policy directive to the Hong Kong government, asking it to prioritize its tasks to put COVID-19 containment on the top. Now, President Xi also requested all provinces, including the Guangdong province, to lend support to the city. A big testing laboratory has been set up with mainland health personnel to support any large-scale compulsory testing. Now, in the studio today, we have Dr. Vitus Leung. Dr. Leung is a Deputy Commissioner of Auxiliary Medical Service, and he is a chairman and member of a number of hospital governing committees. He helps to manage many hospitals here. Now, Dr. Leung, please explain to us, why did President Xi deliver the policy directive just recently? Is Hong Kong cannot really manage the Omicron spread these days?
Well, I think to answer this question, we have to step back a little. Okay, we should study what actually the limits of this society is. Actually, before the Omicron or before actually COVID-19, the hospital authority hospitals has been telling the public that we are having the shortage of manpower. We haven't got enough nurses, we haven't got enough doctors. We're talking about trying to hire nurses from overseas
and doctors
too. Yes,
that's even before the pandemic.
Exactly. So we are actually having a system, the health system, which is in shortage of manpower. Okay. Apart from the hospital authority, which is actually focusing on treating a disease or treating patients, we have a very busy government. Okay. We are talking about electrical election. We are talking about lots of political stuff. We are talking about coming CE election and also all sort of financial issues. In the government, they are trying to use all the government employees from different kind of departments, police, fire, or even the lands department. All these employees has been deployed to combat this COVID-19. Okay, so one very simple indicator is the ongoing buffering department, that is the auxiliary medical service and the civil aid service. These two departments,
they're buffering.
They are buffering the Hong Kong society by providing volunteers.
Right.
Okay, both are having something like 4,000, 5,000 volunteers. At the moment, we are pushing these two volunteer groups to the limit. Even the auxiliary medical service, they are deploying something like 300 volunteers per day. This is quite a large number.
So are you saying that the central government, as well as the Hong Kong government, definitely would have known that there is a shortage of medical staff and supportive auxiliary medical staff, and therefore it leads to the central government lending a hand to the Hong Kong government by supplying materials and laboratories and manpowers and scientific personnel and all this to come to Hong Kong to help? Are you saying that?
Yes, exactly. We are so much appreciate that the central government as well as President Xi knows so much our ongoing situation. I think we have pushed ourselves to the limit already.
Some of them actually blame the government for not doing enough to contain the virus. What's your view on that?
Well, you can't really say that because it is a sudden shoot up of the number of patients. None of the governments in the whole world can actually manage a sudden shoot up like that. We can't have so many people being reserved and wait for this thing to happen. Okay, right. So we rely so much on our mother, our central government. So they have the experience, they have the manpower, they have the knowledge. So this is the only way to do it.
In your view, for so many initiatives that the central government has given us, for example, supply of medical testing laboratory personnel, ensuring the government, Guangdong province will give us adequate food supply. what's the most important thing for Hong Kong now to deal with this?
I think the most important thing is to try to have this compulsory test conducted ASAP, because we have to do it, and so that the whole situation could be controlled. At least we know what's going on, how to deal with all these infected people. So that's the only way to do it.
To do compulsory testing, I'm not sure. Are we doing it in one go? Do we have enough manpower to do it in one go, or should we do it in district by district?
I think the best way is that we should do it in one go in a very short period of time. Otherwise, the whole thing would be meaningless, because there will be cross infections, right? I can see that there's a limit of manpower, especially for the logistic. You know, how we can transport all these samples to the testing laboratory, and of course the testing laboratory, they could increase the limit by having more reagents, more people there. That would be easier.
As far as I understand, the Hong Kong government has already doing a stage by stage or area by area sort of compulsory testing. For example, there's in Kwai Chung, we contain the whole estate to do compulsory testing for that estate. So now what we are saying is compulsory testing simultaneously for all districts. Of course, with the support of the Hong Kong government, the central government, we have a big laboratory now. And what you're saying is there might be still limitation in scientists in collecting these samples from a couple million people within, say, a week in Hong Kong to all deliver that to the center.
That's right.
And then test it. Yeah. So that's the challenge.
It is a very, very big challenge. I think, I'm not sure if our police or disciplinary force is not sufficient to meet that challenge. Maybe we have to use the PLA.
Well, as far as we are citizens understand, the army is really to combat battles and to defend Hong Kong. And of course, we've seen PLA, the People's Liberation Army, cleaning the streets, for example, after the riots and all this. How do you think soldiers would be able to do all these things? You mean soldiers going to homes and knocking on doors and say, give me your sample and all this? Would that?
Well, I think the basic thing is the transportation. They have vehicles. They are very disciplined. As long as they have some kind of training, then they can deliver those safely from one place to another place. So I don't think knocking on doors is necessary, but I think they are all more welcome by Hong Kong people now. They don't need to wear army uniform.
Of course, and carry weapons. All this, yes. They can use training uniforms and all this less agitating type of clothing. What is the as we understand, you are in the legal sector as well as the medical sector. What is Hong Kong's general public's reaction to the policy in directives issued by President Xi?
As far as I can observe, that it's more receptive much more receptive than before. And my own feeling is just like the love of father and son, right? And it is more relief when we heard that President Xi is providing this directive, and the whole central government is supporting Hong Kong at the moment.
Some of the communities has been voices saying that, well, look, I mean, we can't send doctors here because doctors and nurses, they have not been qualified in Hong Kong, and therefore it is better not to have them sent here. But in this sort of urgent situation, what's your view for that, and how do we deal with that one country, two systems issue?
Well, I think for the emergency issue or for a certain period of time, and even for the previous many years ago, say 50, 60 years ago, they have some special registration for doctors. They can also deal with that by registering nurses and other healthcare workers. I think this is very easy in terms of legal points of view.
Put this way, what we need is really people who are working in the laboratory, testing out samples to determine whether the person is infected or not, and for auxiliary medical staff to, for example, give injections to citizens.
Yeah.
Of course, Hong Kong's still the main problem is there aren't enough people wanting or willing to go for injections. Because as you understand, Hong Kong still has a pretty low rate of injection for elderly. What's your view about that? How do we encourage elderlies to go and take shots?
This is a big question, but I think when the government is having the policy of asking the people to have injection before they are allowed to go into restaurants or shops or shopping malls, things like that, then they will be some kind of encouragement there. One of the issues that you just mentioned about the doctors from mainland for a specific purpose, I think this is also essential because we are having all these patients queuing outside the hospitals right now. Okay, we might need to invite the central government to consider building a temporary hospital to house all these patients. Okay, because we're actually having so many thousand patients a day.
Yes.
There's no way that the HA hospitals can accommodate all these patients. So the only way to do it is to find a place to build a hospital quickly, just like what the mainland China have done before, right? But then even we have the hardware, we don't have doctors. Okay,
right.
We need people to look after them. So I think for temporary measures, we might need this kind of experts, doctors from mainland to help.
To treat those patients who are now queuing outside hospital.
Exactly.
And we don't have enough beds, and we don't have enough hospitals, and we don't have enough medical staff and supportive staff. So we all hope that we will be able to deal with this, because the number is actually escalating. We are seeing very exponential, almost increase of confirmed cases. So, well, thank you, Dr. Leung.
Thank you.
This is the program for today. Thank you for watching Legal Affairs. See you next time.